I want to welcome now two current scholars currently studying, completing their studies at university in the UK and as a split-site scholar as well. But first, and I'll introduce them individually, we'll hear the two presentations and then there's another opportunity for questions. So first of all, I'm going to introduce Zaharah Namanda, who's a 2020 Commonwealth Shared Scholar from Uganda, who's studying an MSc in Education Public Policy at the University of Glasgow. She's studying in the UK at the moment, but she's also co-executive director of the Africa Education and Leadership Initiative, a non-governmental organization that provides education and leadership opportunities for refugee girls. And she's also worked for the Foundation for Women Affected by Conflicts in Northern Uganda as a girls' mentor. Zaharah, thank you very, very much for joining us today. We look forward to your presentation and the floor is yours. Thank you, Zaharah.
Thank you very much, Richard, and the Commonwealth Secretariat for organizing this, but also thank you, Margaret, for your wonderful presentation. Well, again, my name is Zaharah Namanda, and I'm a 2020 Commonwealth Shared Scholar from Uganda, undertaking a master's degree in education, public policy, and equity at the University of Glasgow in Scotland. It is really such a great honor to present my research to you all, which focuses on bilingual pedagogy and its impact on refugee students' participation, emotional well-being. Bilingual, I mean more than one language, in form of verbal and non-verbal communication. And pedagogy are the methods of teaching that schools use while instructing learning for students. This is my area of interest because I am very much concerned that in the next 10 years, education for refugee students will not yield lifelong outcomes if language as an education barrier is not exclusively recognized and addressed. As a scholar who is advocating for refugee girls' education in Uganda, my intention is that girls' well-being and participation will be the most affected, and so need to use critical evidence research as an intervention strategy to inform key stakeholders such as government, non-governmental organizations, civil society organizations, as well as refugee hosting schools and communities at both international and local levels. Most importantly, this is evidence for me to lean on while furthering my work, Africa Education and Leadership Initiative, a local NGO in Uganda that is creating education and leadership opportunities for refugee girls, where I serve as the co-executive director. This research aligns with CSC's broader priority of girls' education, but addresses the development theme of access, inclusion, and opportunity, because without inclusive learning methodologies and communication strategies, we are losing the opportunity to build a resilient, peaceful, and healthy global community. My scholarship research considers the current situation for refugees worldwide. In particular, it will focus on Uganda, where my work is based. The UNHCR data 2019 shows that there are 26.3 million refugees worldwide who have fled their home countries, especially due to political insecurities such as war and violence. Majority of the refugees reside from countries such as South Sudan, Syria, Democratic Republic of Congo, Burundi, seeking for protection, neighboring countries like Turkey, Greece, Uganda, among others. Focusing on Uganda as a case study, to date, Uganda hosts 1.4 million refugees, making it third in the world to host the highest number, with 80% being women and children in urgent need of education and protection. Although education is the new hope for refugee children to overcome their tensions, such as finding peace and belonging, nursing of their trauma and emotional unhappiness, as well as fulfilling individual aspirations to lifelong learning and opportunities, there have been barriers to this opportunity. The greatest threat to inclusive education for refugee children is the language of instruction that host countries use while facilitating learning for refugee students. Evidence shows that Uganda uses English as its official language of instruction, which majority of the refugees that Uganda hosts are not proficient. For example, refugees from South Sudan speak Kakwa, Arabic. Refugees from Congo speak Swahili or French. Refugees from Burundi speak Kirundi and French. Research proves that such an instruction leads to a loss of self-identity and is a demeanor for interaction, voicing, and representation of refugees, not only in classroom, but also school and host communities, therefore leading to participation and high emotional distress, especially for refugee girls who also experience other barriers such as early marriage, menstrual trauma, and also being sources of domestic labor within their families. Noticing that this problem has been exacerbated by COVID-19, refugee education access is impeded by lack of digital resources, but also language excludes refugees from actively participating in online learning, which is becoming the new normal. To ensure inclusive education, participation, and well-being for refugee students, especially girls in Uganda, there is need to recognize the cultural tensions that these refugee students experience, including language of instruction and emotional trauma. Evidence shows that languages are interconnected, and so there is no language that is better than the other. If so, refugee mother tongues should be integrated in language policies, since they build a connection for refugees to learn the language of instruction in their host countries, and in this case, English for Uganda. This will result in higher school participation, self-identity, and emotional well-being for refugees who are struggling in the new life context. Schools also should be ambassadors in integrating diversity in curriculum, pedagogy, and assessment to meet individual needs of refugee students. This also means there is need for broad teacher instructional leadership training to ensure that this is a reality. What am I doing? This is my action home. During my stay in Scotland, I have not only been busy working very hard to achieve my master's degree in education, public policy, and equity, but I have been actively engaged with my work in Uganda. My team and I are implementing the well-being program, which is addressing the emotional well-being of local and refugee students, with the majority of the participants being girls during this COVID-19. In 2019, I met Dr. Amy Bentley when I was invited to speak at the University Community Links Conference at the University of California in Berkeley as an international tenacious advocate for refugee girls' education from Africa. My speech entailed frustration of how language and trauma for our Africa ELI refugee girls beneficiaries denied them the opportunity to actively participate and perform academically at school like their peers. During my scholarship period in Scotland, I have been using the knowledge that I've learned from my course to contribute to the well-being pedagogy that Africa ELI is implementing in partnership with the University of California in San Diego, where Dr. Amy works. Well-being pedagogy empowers participants to start by building their self-well-being through mindfulness activities such as the use of art, which provides them with self-confidence to work harmoniously with others in teams. This pedagogy does not only improve learners' communication skills through using talking piece, but also enhances their listening, leadership, and teamworking capabilities, which supports them to deal with the belonging, safety, and emotional well-being challenges. This program's implementation started as a pilot study in November 2020 with 25 participants, including both refugees and local participants. And we are yet to implement the second pilot, which will commence in August 2021. Our two pilots, therefore, will be used as evidence to learn and improve the program in Ugandan context. Our plan is to scale the pedagogy to 100 Ugandan local schools, especially those that host refugee students, if resources permit. learn more about Africa Education and Leadership Initiative, you can follow us on www.africaeli.org, or you can mail me at Zaharah@africaeli.org for further interaction. But wrapping up my presentation, I will leave you with a personal quote, and says that never underestimate the power of language, because it has the foundation to build. Therefore, freedom of language expression should be taken seriously. Thank you so much for listening, and thank you so much the Commonwealth Secretariat team for organizing this and granting me the opportunity to present my research.
Zaharah, thank you so much from all of us. Thank you for your presentation. And thank you for that final image there, which I think is one that we will want to make use of in the CSC, because it makes the point so clearly. The power of language, the power of agency, the power of women to lead change as well. So thank you for your presentation and that final image. Before we move to questions, I want to go on to our next presentation, which is from Deeksha. Deeksha is also a 2020 Commonwealth Scholar. She's a split-site scholar doing a PhD based in India, but also working with the University of Edinburgh. Her base institution is the Tata Institute of Social Sciences, and she's currently studying remotely from her home country. So, Deeksha, the floor is yours, and I look forward to hearing from you. And scholars, there will be an opportunity to ask questions after Deeksha's presentation, both to her and to Zaharah. Thank you.
Thank you, Richard. Good morning, good afternoon, and good evening to everyone joining in from around the globe. I'm absolutely honored to be speaking to this very inspiring community of leaders of today and leaders of tomorrow. My name is Deeksha, and I'm a Commonwealth Split-Site Scholar at the University of Edinburgh. I'm also a doctoral scholar at the School of Social Work in the Tata Institute of Social Sciences in Mumbai, India. My presentation today is titled Caring for All, Building Resilience in Urban Healthcare in India. And it is a part of my ongoing PhD project, which is based in New Delhi, India. As a development researcher and practitioner, I engage with internal migration and its interface with public health and cities in India. Slide next. I will begin the presentation by introducing migration for healthcare as a health-seeking strategy in India, especially for people from regions which continue to have poor medical infrastructure, barriers in access and affordability, and discrimination, which is often based on class, caste, and gender, among many other factors. As someone belonging to one of these many regions in the country, which is characterized by healthcare deficits, I am deeply committed to work towards long-term change in policy and practice to ensure that all people have access to affordable and quality public healthcare in India, irrespective of their economic and social disadvantages. As a Commonwealth Scholar, my thematic engagement is with access, inclusion, and opportunity, and these have become guiding principles in my research and practice. Migration for healthcare is a common health-seeking strategy where patients and their families migrate from rural regions to the metropolitan cities like New Delhi and Bombay to access public healthcare, which is often inaccessible or completely unavailable in their places of origin. Millions of patients travel from small and remote villages to cities in India in search of affordable public healthcare and other support services across the country. My PhD project is an ethnographic study of the everyday life of migrants for healthcare in New Delhi in India as they seek medical care in an unfamiliar location, which is vastly different from their rural realities. The study aims to understand the phenomena through the experiences of poor and low-income patients as they navigate the maze of disease and death in the city and live a life which is tethered to the idea of access to public health care, but does go way beyond in many ways. Next slide. As a social work researcher, I also probe into questions of access, equality, and social justice. And through my study, I try to find answers to the question, how can urban public healthcare systems develop the ability to address the challenges faced by migrants for healthcare? Next slide. Talking specifically about the idea of resilience in public healthcare, the study conceptualizes resilience at three primary levels. The first being healthcare itself, wherein I talk about healthcare infrastructure and healthcare policies. How can urban healthcare systems be strengthened to assimilate migrant patients? And what are the ways in which healthcare policies can effectively address the phenomena of migration for healthcare? Now, as healthcare systems, specifically in the case of my research, are embedded in the urban, cities become an important aspect of the health-seeking process for the low-income and poor patients. So how can cities as physical, social, political spaces become caring spaces for migrants for healthcare? Another important aspect of the urban, especially in the context of India and many other South Asian countries, is the civil society. So how can civil society networks enhance patient experiences and improve access and inclusion in the city for migrant patients? And at the third level, I look at individuals and communities themselves and explore ways of building resilience in individuals and communities to be able to respond better to migration for healthcare, which is a crisis in their lives. So how can individual patients and their families be better equipped to access healthcare in the cities? And how can they financially and psychologically be better prepared to tackle migration seeking healthcare? Next slide. Now discussing development impacts of the research and my work. First, the study highlights the inequality in access, which has now come to characterize the Indian public healthcare system. And the study documents how the poor and marginalized experience this exclusion on pretty much an everyday basis. As many of us know, health research is often dominated by numbers and numerical data, oblivious to people, their experiences, and also their aspirations from institutions like the hospital and sometimes even the state. Through this study, I want to methodologically contribute through highlighting the voices of the most marginalized, but to also see how these voices themselves can inform policy and build a more people and poor-friendly policy in the field of healthcare. The second aspect that I look at is to better the healthcare systems itself. The study will identify the policies and practices pertaining to healthcare to strengthen systems and processes of access and inclusion. Also suggest policies and practices which are designed keeping in mind those who often fall through the cracks and get deeper into poverty and suffering. The third aspect I look at is the idea of civil society and the importance of building resilient civil society. The role of the civil society in making possible a life of dignity and ease of access to medical treatment and welfare benefits is enormous. Resilience in the healthcare system, especially in the context of urban India, cannot be limited to hospitals and policies alone, but has to include a civil society which caters to the needs of migrant poor, but also constantly work towards building a conducive and accessible urban space and society. Next slide. The pandemic and how it has specifically unfolded in India has brought global attention to the importance of public healthcare resilience. As a way forward, I understand that resilient healthcare systems will ensure a life of dignity and equality for all. And as a researcher and practitioner, I aim for impact and real changes in the life of the most marginalized. As a way forward, I intend to engage with policy, which is policy through evidence-based research, and work towards advocacy, which is rights-based and based on the ideals of social justice and equality. Both policy and both the research and advocacy shall inform policy and practice in the area of public healthcare resilience in India. And I hope through my work, research, advocacy, sooner we will be able to achieve our goal to leave no one behind. That's my presentation. Thank you so much for listening in. And I'm looking forward to your questions, feedbacks, and suggestions. Thank you.